Good morning. My name is Denis Okidi Ladwar from the USAID Strengthening Supply Chain Systems activity in Uganda. The activity is implemented by Management Sciences for Health. I am happy to present to you a paper on the impact of supervision, performance assessment, and recognition strategy SPARS to improve supply chain management in health facilities in Uganda. Our study was a national pre-post study, and the other co-authors are on the screen. So I'll go straight to the background. The Ministry of Health in Uganda has been committed over the last many years to improve availability and access to essential medicines to its population. Key to that is building capacity of the human resources at all levels to manage supply chain. And over the past many years, they have tried a number of interventions, including predominantly educational interventions that did not produce effective but also sustainable results. So with funding from USAID and with support from MSH, the Ministry of Health conceptualized and implemented the multi-pronged SPARS approach. And of course, this paper now presents to you the impact of SPARS on supply chain management. So briefly, just to give you an overview of what SPARS is, as I mentioned, it's multi-pronged. It has 5 prongs that all are intended to improve medicines management. The first prong is the educational approach, where trained district health workers called medicines management supervisors offer routine mentorship and coaching at the facility. We combined that with managerial approaches where we provided guidelines, manuals, tools to the health facilities to improve practice. The MMSs at every visit provided rigorous performance assessments that was tracked over time. We also recognized good performing facilities, good performing medicines management supervisors, and good performing districts with various souvenirs, but also tools to improve medicines management like shelves, temperature monitoring devices, calculators to help in stock management, and so on and so forth. The last prong was the regulatory arm that basically we collaborated with the National Medicines Regulatory Authority here to certify facilities for good pharmacy practices. So by way of methodology, as I mentioned before, our study was a pre-post indicator-based comparison of the effect of SPARS on supply chain management practices at the facility. So the district health workers, who we called medicines management supervisors, were key to this paper. They actually implemented and did the performance assessments at the facilities. So between 2010 and 2013, when this whole SPARS approach was initiated, 1,222 visits were conducted to facilities nationwide, and we then assessed the impact of these visits on 13 indicators, which in total had 38 measures, and we also explored factors that influenced outcome of these interventions, basically from the implementer and management perspective, but also from the facility perspectives. So again, we did a quick survey of the characteristics of the MMS, the characteristics of the DHO, and also looked at some facility aspects that we thought would affect or impact on SPA's effectiveness. So the results, as you can see, the number of facilities reaching acceptable scores improved from 43% at the first visit to 62% at the last visit. Also, we found that a greater proportion of hospitals reached this acceptable score than the lower level facilities, health center 3s and 2s. The measures that were included in the study were basically divided into two. There were resource measures that required finances to improve, but also behavioral measures that did not require finances, but mainly change of behavior. So the resource measures actually improved much less than the behavioral measures in our study. The results after 1 year of implementation for each facility, we found that there was a significant improvement of 16 percentage points in all areas combined, but specifically for the 3 areas, we found that for the stock management, there was an improvement of 22 percentage points, which was not significant, but for the other 2 areas, the storage management area and the ordering and reporting area, we had a percent improvement of 16 and 11 respectively, and they were significant. So the study also looked at the other predictors, which we found was significant to impacting on SPA's performance at the facilities. We found that the initial score at the facility was an important predictor. We found that the frequency of visits to the facility was another important predictor, but more importantly is the engagement of the district health officers in stewardship of the SPA's intervention was very important. So the results basically in that graphic talk towards the SPA's intervention overall being significant. You can see that for each and every measure we had an impact positively, although it varied depending on the score at the initial visit. But overall, those who scored low improved more, and those who were already high improved less. So our limitations of the study, basically we utilized the medicines management supervisors who were not our staff. So basically they implemented and chose facilities as guided by us, but sometimes they did as they wished. We also didn't have a control group. So because the SPA's approach was a national strategy, we couldn't have a control group at that time. We did not also stratify the measures at visit 1 to make sure that as we were analyzing impact, we grouped the measures that scored similarly so that we could see that the improvements at the last visit were really devoid of any other external influences. But again, this was because we had a very large number of measures that we were looking at, so it was difficult to stratify. The predictors analysis was based on findings of a survey that was 75% responsive, so we think that this could have an impact, but we also don't think that the impact is really very significant on the findings that we see. In conclusion, SPA's is very effective in building supply chain management capacity. The impact is even more at lower level compared to higher level. And we actually also conclude that we could utilize the findings of the predictors to optimize SPA's implementation moving forward, and also recommend that SPA's, given the effectiveness we have seen, can be used to improve performance of health workers in all other vertical program implementation areas like HIV, laboratory, tuberculosis, and we should also be able to use a similar approach, not only for supply chain management, but for other specific clinical areas, given the effectiveness in its impact in improving health worker behavior. So we would like to acknowledge USAID for the funding, Ministry of Health Pharmacy Department for the stewardship of the whole program, the district health officers and medicines management supervisors for the implementation. And of course, I can't stop the presentation without acknowledging the co-authors of the study. So thank you very much.